Hello. Today we will discuss about the OSCE, OSPI and DOPS. So as per NCISM guidelines for the curriculum, which started from the last year batch, this is I think so the NCISM's third batch, that is 2023 and 24 batch, which is ongoing, and the previous two batches, the one which has given the MHS exam and the one which has passed and is in the second year. So what happens is under the MHS guidelines, the curriculum is designed according to the Miller's pyramid and Bloom's taxonomy. That is all six levels of comprehension, knowledge, remembering, understanding, etc. in Bloom's taxonomy, and four levels of the Miller's pyramid. That is knows, that is knowledge, knows how, shows how, and does, that is application in real world. So these levels of the Bloom's taxonomy and Miller's pyramid have to be uh, considered while assessing and providing or application of the curriculum to the first year health professionals. In terms of Rachna Sharir or in terms of anatomy, when we consider um, OSCE and OSPI, that is objective structured clinical examination, objective structured practical examination. So for anatomy, most of it, the OSPI is being carried out, that is objective structured practical examination. So how the assessment, what are the objectives and what is the task being given to the students? So there are three stations, the first, second and third. In the first station, for example, if we start with the anatomy of the stomach, then in the first station you will find the objective that the student should know the position, location, size, shape, structure of the specimen with identification as the most important prior condition. So in the next station there will be next two objectives with the task given as the student should know the subdivisions of stomach and the stomach bed. In the third station, when the student goes and when he is being assessed, then there are questions like the clinical anatomy, applicability of the specimen, that is stomach, and radiograph images, then any clinical conditions or case based learning, etc. So under station 1, 2 and 3, the mild, moderate and severe level questions are being asked and students are being assessed. This can be done through oral or through written, but oral viva voce is a good method of assessment for this type of OSPI, that is objective structure practical examination. Now let us talk about DOPS. So now what is DOPS? DOPS is direct observation of procedural skills. For example, when the dissection of axilla is being going on, the students are assessed by asking some questions during the procedural of dissection. For example, what is axilla? What are the boundaries of axilla? What are the contents of axilla? What is the clinical applicability of axilla? What are the branches of axillary artery, and etc. So this can be assessed, DOPS method can be assessed to all the other topics related to dissection. Even 9 quadrants of abdomen can be asked. Even it can be used for demonstration of bones, demonstration of specimens specifically, um, then lines of incision, and even for the dissection of the central nervous system. So these are the methods of assessment and the levels being assessed on the basis of Miller's pyramid and Bloom's taxonomy. So students, I'm sharing this video just because you should know certain things which are very mandatory as per your new curriculum by NCISM. COPO I will add into it in the last now segment of this video. CO is course outcome, PO is program outcome. Now MBBS, BMS, BHMS, BDS, this degree is a program, and the subjects under this program like anatomy, physiology, microbiology, Ayurvedic some subjects, homeopathic some subjects during the whole program for the first year, second year, third year, etc. These are the courses. Subject is a course, degree is a program. So course outcome and program outcomes, these both are mapped, and on mapping this we are able to find out whether the course outcome are matched to the program outcomes. Hence, in the NCISM curriculum, along with the graduate attributes, COPO are been designed and given particularly in the initial stage of curriculum designing. So, students should also know what are COPOs along with OSCE, OSPE, DOPS, and most important, finally, I would add some SLOs. That is for every topic. For example, for cardiovascular system, along with heart, pericardium, and all the arteries related to the heart and veins related to heart, there are 8 lectures assigned with 3 non-lectures. So, while doing or while carrying out the curriculum, while implementing the curriculum by NCISM for the first year students, the students should also know that for each topic, for each lesson, there is SLO. There are SLOs like specific learning objectives. For example, when we talk about the cardiovascular system, uh, the prime anatomy of the heart, right from the location, shape, dimensions up to the applied aspect and histology, then the pericardium, then the major arteries and vessels related to the heart in terms of anatomy. This all comes under the specific learning objectives. So at the end of the lesson, at the end of the topic, at the end of that segment, the student will be able to, and that is how the SLOs are defined. So I hope my students are familiar with the COPO, SLOs, OSCE, OSPE, DOPS. Thank you.